welcome to yet another exciting episode on Trending Talks. Today, we want to educate our viewers on a deadly disease or sickness that is very easy to commonize. I am your presenter, Precious Mary. Remember, on Trending Talks, no right or wrong answer, just real and honest conversation. And to make this conversation a very real one, we have a doctor with us today on Trending Talks. I will want him to introduce himself.
Thank you very much.
You're welcome, sir.
My name is Dr. Moseli Amir Solomon. I'm a medical practitioner and I work with Edo State government. It's nice having you around.
Thank you very much,
Thank you
sir.
very much.
I've had a situation where I fall ill or someone around me falls ill. And when they ask, what's the issue? I say malaria. And there's this, okay, that's something small. So that's the reason I want us to discuss today. What is malaria?
Thank you very much. We live in tropical Africa and we are in West Africa,
Yes.
Nigeria in particular. Because of that, malaria is one of the commonest diseases that we find around us because it favors those who live in the tropics. And because of that, malaria is actually caused when a female Anopheles mosquito bites someone. And when it does that, it injects some of his, some of those, what will I call it now? Inject some of these viruses, bacteria into this person. And when it does that, the body reacts through that process. And many people think that malaria can actually be contacted by touch, or maybe can be contacted by maybe touching someone or coughing, or no. It is actually contacted through the bite of the mosquito, especially female Anopheles mosquito.
Okay, thank you very much, sir. But why is malaria a major health challenge?
And the reason why it's a major challenge in Nigeria is because, in Nigeria, if you look at the poverty index, you see that Nigeria is people living in the country, we are all struggling because of the nature of our country, and there is poverty all over. And because of that, most of the time, you notice that, because I said earlier that the tropics, the environment favors the incubation of this mosquito, you see that it is more common. You can't see it in some other countries aside Africa. Despite there are now indications that they're saying there were some of these places where it was seen. So the main cause is that one, poverty, because our environments are not clean. There's stagnant water around, there are bushes, and these bushes around, they favor the incubation of this malaria. And with that, you see that it becomes a very big problem for us to solve in Nigeria. Okay. So this is actually the main issue.
So that establishes a fact that malaria increases, or the case of malaria increases during rainy season.
Yes, because during the rainy season, just as I said earlier, you see that there is stagnant water, our environments are not properly kept, there are no drainage. Even when there are drainage, some of this drainage enters some people's house, and then there are bushes around, not properly clean, even though the government is trying to make sure that there is a compulsory environmental sanitation. And then, because during this period, because of poverty too, you see that mosquito-treated nets are not made available. Even for those who have it, some persons are even discouraged of using it. Some places when they use mosquito-treated nets, they are not comfortable when they sleep. So these are some of the reasons why during rainy season we try to give a talk. We try to make sure, educate persons and make them see the reasons why malaria, and then taking care and making sure that prevention is actually the best way for the treatment of malaria.
Okay, but is it that we are not using these treated nets, this mosquito treated nets? Is it that we are not using it correctly? Is there a correct way to use it, or is this mosquito net, is it very effective?
Yes, mosquito treated net, not just net.
Yes, mosquito
treated very effective because most of the time we use mosquito treated nets. It actually prevents mosquito from biting.
Okay.
And with that, because it has prevented, nothing comes into you, and with that it goes a long way in helping to prevent malaria. And there are also some other mosquito repellents that we use. We use mosquito repellents. This is also you can rub on your body, and also it will help also repair this mosquito from coming or getting to any human.
Okay, I want you to please educate us a little on how to use mosquito nets, because I feel that we're not using it the correct way. Because when I had mosquito net at some point in time
Mm,
given to me by the government,
mm.
they told us to put it outside but not under the sun. So I think, but just maybe put it on the veranda or something. There was a way they told us to use it.
Oh, okay. With what you have said, when you get a mosquito treated net, maybe from government, these things they are kept, they are done with, there's chemical added to them.
Yes.
And because of this chemical, these are what even makes the mosquito repaired and then also help to prevent them from coming in. They are not just like normal nets that you see. So because of that, because of the effectiveness of those chemicals, when you get them, and because of the histories and because of the allergies some people have to some of these chemicals, so when you get them, it's expected that you expose them so that some of all these chemicals get out, because there have been incidents of persons who have allergy to this, and some of them even had serious issues. So the best way out, you just try to make sure that you expose them first before bringing them to keep inside your house or wherever you want to put them, because at the end of the day, most time when you are exposed to this can cause respiratory issues.
Yes.
And at the end of the day, you see that in the process of you trying to curb one issue, you're not having another issue. So that's actually the problem.
Thank you very much.
You're welcome.
But which age group or is there a set of persons that are prone to malaria?
Yeah, as far as you're in Nigeria, everybody is prone to malaria, one. But yes, there are age groups that are prone to malaria. Let's take, for instance, children. Children below the ages of 5 are prone to malaria. Why? Because as a growing child, the immune system is not well developed. So because of this, most of the time, they fall ill easily. And because the immune system is never developed, they can have complications. And some of all these complications can even lead to death of some of these persons. So I said children below the ages of 5, then pregnant women. Pregnant women are also prone to this because once you get pregnant, your immune system also goes down. And then we are no longer only talking about the mother, we're also looking at the unborn baby too. So there is this intermittent prevention of malaria that you do. That's why it is advised during pregnancy, you start antenatal. In the process of you going for antenatal, there are some medications that will be given to you to prevent malaria.
Yes.
And this will not help to reduce mortality and incidence. Now, the other age group, the other group are prone to this. If you have maybe those whose immune system are very down, take for instance those with retroviral diseases, those who already have some other renal issues, as far as your immune system is down, it tend to affect some of this, and makes whenever you have malaria, it becomes so serious and very severe. But other age group that can also be involved, elderly. So you see children, I've talked about pregnant women, I've talked about the elderly, I've talked about the immunocompromised. We call them the immunocompromised. Okay. So these are the people who generally we say they are more prone to it. But nevertheless, as far as we are in this country and you are living in Nigeria, it is expected that malaria, mosquito, Anopheles mosquito, you must get to have a bite because you go out. But if you are having a very serene environment around you, a clean and a very well-kept environment, it also reduces the incidence of you having malaria.
Okay, so what are the signs and symptoms I should look out for first?
Okay.
Before it gets into severe malaria.
So in the real pathophysiology of malaria is that when there are Anopheles mosquito bites, they release what we call sporozoites. What it does, I will just say it in a layman. What it does is that sporozoites are released into the bloodstream. Yes. And when it goes into the bloodstream, it goes straight to the liver. When it gets to the liver, what it does is that the liver, it increases it multiplies within the liver. And once it multiplies within the liver, immediately it's sent to the bloodstream back to the bloodstream where it goes straight to the red blood cells. And you know the red blood cells are the one that they contain hemoglobin that sends oxygen to all tissues and all part of the body. And then, as red blood cell too, it helps to make sure that the immune system is also a bit balanced despite the white blood cell. Now, what eventually happens that every red blood cell that's what has been released into the system gets infected, and with time it break this split. The process of splitting, they get to meet with other contact with other red blood cells and multiply again. And at the end of it, what now happens is that what they produce, they're sticky in nature. Those sticky, they go to get stick around the blood vessels. And when they stick around these blood vessels, before then, you see that the body will not want to react to it. What happens? That's there I'm going, which is the symptoms. So the body will not want to react to it. And they will be releasing some of these chemicals. And when they release this chemical, what you now see as somebody who will have malaria is so fever, temperature spike, the person will be having chills and rigor. Chills and rigors will be taking place. And over time, you see malaria, loss of appetite. You start seeing in cases, you see the person is having weakness, because I told you about the red blood cell. Because each time those red blood cells are broken down, the red blood cell increases. So the early signs and symptoms you see are some of these symptoms. Sometimes you see have abdominal pain. So for the early symptoms you just see at the beginning is fever, chills and rigors. You cannot see loss of appetite, even weight. Weight loss is towards the end, but
there's no appetite now.
so these are the early symptoms that you can see when the patient presents.
Thank you very much. The program is a short one, so I believe subsequently we would have you to talk to us on other topics. But before we go, I want us to address an issue. Should I just go to the hospital and tell them, give me a drug for an anti-malaria drug, or I have to be tested? So that's just all I want to know. Should I be tested first, or should I just buy drugs to treat malaria?
Well, set medication is discouraged. It can lead to drug resistance, and you can actually, it's not all fever that malaria fever. So that's one thing. Because I just said somebody's having his temperature spike of 40 or 39 and he's having fever. Fever can be there, it can be another thing. So you coming to the hospital, coming to a facility, a healthcare facility, is for you to see a professional who, by virtue of his wisdom, will be able to assess you and then have an examination done on you, giving history, and the history, the medical practitioner then interprets it, and then have an examination done on you. And it's expected that he will want you to run some tests. And in the process of running this test, you get to see the severity of the malaria, and then with that, proper prescription could be made. Because if you don't do that, somebody can actually have malaria and goes somewhere and gets overdose of the drug. That can also cause a problem. Another problem. Yes. So, and then somebody can also decide to say he goes to a chemist shop and said, because I'm having fever, give me a drug. And you are treating fever. At the end of the day, you discover that you are often dealing with Lassa fever, not malaria fever. So it's these are some of the issues that come into our terrain based on our peculiarity.
Thank you very much.